benefit from hearing their story. Martha, I want to get you into this because I wanted to ask you, I want you to tell me how the pandemic has affected the community in the areas of mental health and domestic violence.
Well, thank you, Val. I think one of the, the lockdown may have decreased the spread of COVID, but I think it created an ideal environment for domestic violence. There were so many stresses that came with it, between the job loss, financial stresses. It just created this environment of that you guys talked about, right? Control and coercion. In terms of mental health, if you're thinking of domestic violence survivors, there's very much that there are very high risk for experiencing a range of mental health conditions. PTSD, depression, anxiety. We have a location for domestic violence, or program is called Pazdro, which in English is enough, right? And one of our locations in the Belmont Craig neighborhood works with our members of the community who come in for support. But that location also has a living room program, which is community-based crisis support. A specialist are there. So when you're having a domestic violence survivor come in for support, we're providing them that support, those linkage to communities, that advocacy that they're looking for, but immediately having that warm handoff to actually a peer support to walk through some of those emotional crises they're going through. And I think because both issues are interrelated, you have to have the mental health support available right away. That's one of the successes of that site, is that you have that link between those two programs. They are providing that service to the much needed to the community. And as all of you guys know, with COVID, I mean, our numbers dropped of survivors seeking help. You can't make a phone call when you have the perpetrator, the person who's abusing you, in the next room or in the room with you.
Right.
The other piece is that we are all trained to observe signs of abuse. We are all observed to observe behaviors. And when you don't have them come into the services and you're just doing Zoom, you miss so many of those cues that really limit the access, that limit us from providing that support. And if I can go back, Val, in terms of, people that are listening, they're watching this, how can you tell that something's happening? Aside from the stigma that was mentioned, there's huge stigma not to talk about it. There's huge stigma not to be that person, because it's hard to acknowledge that you're in this situation. It's hard to see it when you're so close to it. It's so hard to see it. I think really teaching people to observe some behaviors. Or are you noticing somebody who's excessively jealous? Somebody who's embarrassing or insulting their partner in public, yelling or intimidating? Those things should be red flags. If it's somebody who's close to you, I mean, are you noticing any sort of like submission, any signs? I mean, clearly physical signs that you might see on a person, any anxiety about pleasing their partner. All these things are red flags. And I think very much coming from that non-judgmental, right? It's not your fault. And I'm here to listen as a family member. And as a friend that I have been, those two pieces are big. I'm here to listen and not to normalize that behavior, because it is not right. None of the stuff that is happening, the coercion, the control, is not right. And that constant message needs to be passed along at all times, really.
You mentioned how difficult it has been with the pandemic and COVID, because you can't really call out your perpetrator because they may be in the next room. Any advice for those folks who are tuning in right now on how they can pick up on some of the things that you just mentioned, whether it be virtually or over the phone? Because now, some people, we are getting back to normal and people are out and about again. But let's just say, it's one of those situations where they might have to do some other kind of, paying attention to decipher whether this person's in trouble or not.
Absolutely. Facial expressions, tone of voice, body language is huge. Even though we're not really seeing the entire person, you can tell when you might mention your partner, the voice will soften because he could hear. Right? Face will freeze. So everything tenses up, and we're trained to pick up those cues, even through Zoom, thankfully. So those are some of the things that are really turn out to be red flags for us in this limited medium that we have at the moment. But thankfully, as you mentioned, Val, we are returning to face-to-face services. So we're kind of going back to that support